Hey guys, Lance here again with Medicare Advisors. And so we're a team of friendly licensed agents dedicated to helping seniors navigate the complex world of Medicare. So today I'm going to discuss about Medicare and employer coverage with large companies of 20 plus employees. But before I start, please remember the information I'm sharing is just for your general knowledge. If you really want to maximize your Medicare benefits by getting the best coverage for the lowest amount possible, call our toll-free number at 1-800-240-5241 between 8 a.m. and 6 p.m. Eastern Standard Time Zone. The number will be displayed on the bottom left throughout this video for your convenience. Okay, so let's get started with today's topic. So Medicare is secondary if you are age 65 or older and your employer has more than 20 employees and you are still actively working, not a retiree or on Cobra. This is called Medicare Secondary Payer. In this scenario, your group plan pays first and then Medicare pays second. Most active employees with group coverage enroll in Part A because it's premium free if you have worked at least 10 years. Now, Part A can coordinate to lower your costs if you have a hospital stay, for example. And let's say your employer health plan has a $3,000 deductible. The Medicare Part A hospital deductible is $1,484 in 2021. So if you have both your employer insurance and Part A, and you incur a bill for a hospital stay, you will only be out $1,484 for your inpatient hospital services. Medicare pays the rest of any Part A services. It doesn't necessarily work the same way with Part B, and Part B costs money. That's something to see in our other videos. So that's why most people choose Part A only when working for a large employer. Now, one exception would be if you are contributing to an HSA and plan to continue doing so. If that's the case, don't enroll in Part A. Now, Part B is not premium free. You will pay monthly premium for Part B based on your income. Some people who are eligible for Medicare and employer group health coverage choose to delay in enrolling in Medicare Part B and Part D while still covered on their group health coverage or their spouse's group health coverage. This saves them the premiums they would have paid for those parts. Your employer coverage already includes outpatient benefits, so it may not be worth it to pay those Part B and D premiums. Now, when you do delay Part B, your large group plan is considered credible coverage. That means that you can enroll in Part B later without a late penalty when you decide to retire. And once you quit and leave the group plan, your insurance company will mail you a credible coverage letter. Just be sure you keep this. You will need it to show Medicare that you had other coverage so that you're not subject to late penalties for Parts B and D. Also, a lot of people ask us what happens if they retire, get Part B, and then later get a new job with employer insurance. You can cancel Part B at that time. Later, when you retire again, you'll have a second 6-month open enrollment window to get a Medigap plan with no health questions asked. Now, Medicare coordinates differently with Cobra than it does with active coverage. This is important because so many people get this wrong and then owe penalties. When you are still actively working at a large employer, their group insurance pays primary and Medicare pays secondary. The opposite is true of Cobra. Medicare pays first and Cobra pays second. So, if you have Cobra and then become eligible for Medicare, usually at age 65, then you must enroll in Part A and Part B during your initial enrollment period. Your Cobra typically ends when your Medicare begins. So failure to enroll during your IEP will result in a lifelong penalty. However, your dependents can keep Cobra for up to 3 years, even if you enroll in Medicare. And if you work past age 65 and then you retire, you're allowed to enroll in Cobra. You must also enroll in Part B no later than your 8th month on Cobra insurance, even if Cobra continues beyond that because Medicare pays primary and Cobra pays secondary. However, it's recommended you enroll in Part B as soon as you become eligible for Medicare. If you don't, your Cobra may not pay its share since it's secondary to Medicare. And failure to enroll in Medicare by the 8th month can result in permanent late enrollment penalty for Part B. Even worse, it could delay your Medicare Part B until July of the following year. You don't want to find yourself in a situation where you have to wait months to buy Part B during the next general enrollment period. Now, there is one exception for people with end-stage renal disease. If you have ESRD, your Cobra will pay primary during a special 30-month coordination period between Medicare and Cobra. So people with large group employer insurance also have another option. You can leave your group health plan and choose Medicare as your primary insurance, and then add a Medigap plan. Now, this can often be cheaper for you or your spouse. For many people, it will also reduce your deductible spending and eliminate, all doctor copays. Whether this is cost effective depends on how much your employer coverage costs you each month and your payroll deductions. Your plan deductible, copays, and your medication usage also are factors. Now, if you're married and one spouse is younger, you must also consider the cost of health insurance for the spouse of the Medicare recipient. So if you're getting ready to enroll in Medicare for the first time, or if you're already enrolled in Medicare, one of the most important things you can do is review all your options as Medicare plans and benefits are updating and changing each year. Now, if you're enrolling for the first time, it can be very confusing trying to figure out which plan will be right for you. And if you're already enrolled, it's a good idea to review your coverage each year because you could be missing out on some important benefits offered by the major providers in your state. By reviewing your coverage, you may be able to upgrade your benefits without having to pay more money. But in either situation, this can be confusing to try and figure out all these things on your own. So fortunately, there is a very simple way to get the most recent benefits without having to call several insurance companies or even spend endless amounts of time scrolling through the internet. There is a completely free, no obligation helpline to give those enrolling in Medicare for the first time or those already enrolled in Medicare the information they need to take advantage of all the most recent benefits available to them. So if you're wondering about how to sign up for Medicare and finding the right plan for you, or if you're worried you don't fully understand your current Medicare plan, or maybe you're just curious about other types of benefits you could get at no extra cost. Either way, you can go ahead and call this toll-free number, 1-800-240-5241, which you can see on the bottom left of the screen. We are open Monday through Saturday, 8 a.m. till 6 p.m. Eastern Standard Time. Then once you call, you'll get the chance to speak with someone who will be happy to answer any questions you might have and find you the best coverage available for you and your particular situation. And even if it's outside the annual enrollment period, it's still very easy to switch your plan if you'd like to do so. Also, if you have any questions you'd like to post down in the comment section below, we love getting to answer as many of those as we can. But otherwise, I hope this video was helpful, and I'll look forward to seeing you in the next video.